Welcome to PR Talk, sponsored by the PRSA of Oregon and part of the MPN, the Marketing Podcast Network. This is your host, Amy Rosenberg, founder of Veracity and author of A Modern Guide to Public Relations. Help other people find our podcast by subscribing, rating, giving us a review, or sharing on social media. Hi, everybody. I have Dr. Douglas Kalman here today. Hi, Dr. Kalman.
Hello, Amy. How are you doing?
Good. Thank you. Before I tell everyone who you are and what you're all about, where are you joining us from today? What area of the country are you in?
I am joining you from the great state of Florida. And I am joining you from a state where we have two temperatures, hot and hotter.
Okay. Sounds good to me. I'm in Portland and it's probably raining outside, but I don't know. But so everybody knows, Dr. Kalman is the SVP of Science and Regulatory Affairs at the Natural Products Association and adjunct faculty at Nova Southeastern University. So before getting into how to be a thought leader, because Dr. Kalman definitely is a thought leader, and ethical marketing and getting a research paper published, I just wanted to get a little bit into your background. So before I let you tell us, how you got involved in your industry and how, what it's like to work at the NPA. I found a little bio on you, which said that you, and I figured you'd forget this. So I thought all of the things you do. So I thought I'd just read this super quick.
Sure.
Well, I'm not going to read a bio, but basically you have been involved in over 250 clinical trials. You've published over 80 abstracts and more than 60 peer-reviewed manuscripts. You are the co-editor of the International Society of Sports Nutrition Journal. That's hard. I'm going to fumble over that one. And on the editorial board of 3 other scientific journals. So anyway, just tell us about what you do and the NPA and everything you're working on.
Well, thank you for such a nice introduction. I'm a fortunate individual who gets to work in an industry that early in my life was more of a interest and passion. So honestly, as a teenager, I was very interested in why is it that we get diseases from foods that we do not eat, yet we can also use foods to recover from those diseases or conditions. As a teenager, that intrigued me. And it's not maybe the normal thing that intrigues teenagers, but so I was doing all the reading that I can, on health, on dietary intake, on vitamins and minerals and much more. And I was fortunate at the time to sort of have a mentor. And this is still while I was just about to start college, where I had a mentor who is a very acclaimed cardiologist who's in my family, who would send me medical books, send me journals, and try to teach me how to read them, when I was 17, 18 years old. And that actually started my interest in wanting to have a deeper understanding of, the things that make up our life. And part of that is how you eat, what you eat, when you eat, what your lifestyle is like in terms of exercise or not exercise, in terms of alcohol use, tobacco use, and all sorts of other related issues. Concurrently to that, I've always been an athlete. So the major sports I did when I was younger were wrestling, baseball, and football. Wrestling is a weight-based sport. And so I learned early on unhealthy and healthy ways of how to make weight, which later on when I was getting a nutrition education, then I learned about how to actually put together meal and nutrition plans for healthy weight loss and for athletic performance. I've been excited that so far I've been able to work 6 Olympic Games as a sports nutritionist for American athletes representing the U.S. and been able to travel to many of the countries where we've had the past Olympics, winter and summer. And so that, the experiences globally, the experiences of working 30 years in academia, research, and industry, or supportive of industry, has allowed me to get a purview of what's going on in the nutrition world, what's going on in public health, what's going on as related to evidence-based teachings, and what are consumers interested in. And, all of this leads to exciting times, because I don't think that you could literally go 5 or 6 days, let's say a week, make it easy. If you watch the regular news or read a newspaper, whether it's online or in print or on TV, whatever these days, and my point that I'm trying to bring up is every week we hear some type of public health, nutrition story being discussed. And so
definitely
that and those are always indicative of the popularity of the topic. And but it also shows me sometimes when I hear some of the television shows or even news reporters reporting things, the veracity of what they report is always not accurate. And that happens.
So, and then to kind of dig into that, when you say the veracity is not always correct, do you think that possibly it's because of the marketers kind of putting a spin on it that isn't correct? And if so, what do you think about that?
Well, it is very well quite possible, if that is proper English, that there are a few different reasons why sometimes when there's a scientific study that is then going from, let's say, the scientific medium to popular press, that things get lost in translation. Some of it is potentially can be a marketing spin that somebody wants. Another part can be that the people that are reading it and then interpreting it for the news reporter are actually not competent in what they're reading, or not as competent as they thought. And I'll give a great example, a positive example here. There's a dear friend of mine, Dr. Sean Caniff, and you may or may not remember his name, but if you were a fan or are a fan, but if you were a fan of the Survivor TV show, Dr. Caniff was on the first season. So the original opening year or season of Survivor, and Dr. Caniff was on that show. And he's a neurologist. And I bring that up because after, he finished that show and he was trying to decide what he was doing besides maintaining his medical career as an active neurologist, still seeing patients, many television stations and media companies came to him because he's smart, presentable, a physician, understands science. And then he became a voice for translating studies and other information that are pertinent, on regular newscasts for CBS for a number of years. And, and we all know that there's Dr. Sanjay Gupta on, I don't know if he's still on CNN, but he does basically the same thing. And I think that we need that. So sometimes we get misinformation because marketing is using disinformation or information that they want, which may not be most truthful or most accurate. And other times it's because some of the people reading it don't necessarily understand what they're reading. So when we do these studies, because we do a lot of nutritional supplement marketing here at Veracity. So when our client does a study, we rely on people like Dr. Kalman to help translate. And also, and sometimes PR people and marketers just need to be kept in line. And what that means is that we, as our job, we have a tendency to exaggerate. I exaggerate just in conversation because it's just makes it more interesting. Not that I lie, but we're PR people. We do sometimes exaggerate. And so, we're lucky at Veracity that our clients are very ethical, and we will sometimes we just don't even want to talk about certain things because there's no point, but some clients might not be like that, and they do want you to over emphasize. So if you use somebody, or if you can kind of have an intermediary to explain some of the research, and then
point you in the right direction if you're trying to, go a different route with it or emphasize something that could be helpful, especially when we're talking about ethical marketing.
Right.
And so I don't know, in terms of other kind of examples of ethical supplement or natural product marketing that we could talk about. I mean, another thing that we hear about is not talking about health claims too much. I don't know what you think about that.
Well, there's a lot to unpack here. And so the word ethics itself is a lot to unpack. Some people don't know what it means. Some people don't understand ethical versus non-ethical behavior. And I think of when we talk about ethical behavior, we're talking about doing the right thing. But what that right thing is for everybody might be different. And so within, let's say, dietary supplements, yes, we cannot deny that there have been people that make claims in marketing that have no basis in reality. And that's why, unfortunately, the term snake oil salesman was associated with dietary supplements. And then we have people that do, accurate marketing. And what's of interest to me is that the Federal Trade Commission, which is a U.S. governmental agency, the Federal Trade Commission, the FTC is the governing agency which regulates advertising and marketing in the United States. And specifically, there are laws set up by the FTC to help an individual or a company determine whether they are making a substantiated claim or not. And it's a term that's called the Pfizer factors. And because there was an original case in the early 1960s involving the pharmaceutical company Pfizer related to marketing. And ultimately, a definition became apparent and written into FTC law about the Pfizer factors. So basically, the Pfizer factors is also known as the reasonable basis standard. And so the Federal Trade Commission will look at what type of claim is it? What type of product is it? What are the benefits of a truthful claim? How easy is it for a company to substantiate this claim? What would be the consequences of a false claim? And would other experts in the field agree that these claims are reasonable?
So then could we as marketers just look that up and kind of run through our scenarios through the Pfizer factor?
Well, that would be one. That would be one way of doing a first check. That do you have reasonable basis for the claims that you're making? And if you do, then you move ahead. If you don't, then maybe you check another box. Why don't we? And what am I missing? Or what are we missing? And so the Pfizer factors are one part of it. And there are more, but like you said, let's just, discuss this all globally.
Yeah. And then, not that I want to be sneaky or anything, but it just kind of opens up the discussion. Does the FTC even look at some of this stuff? I mean, and this does go into a bigger conversation about regulation, which I did want to talk with you about the introduction of the recent Durbin Bill, which we'll talk about that.
Yes.
And I want to explain to everyone why we'll talk about that. But quickly, the FTC, do they even look at this stuff? Or is that just kind of like, here's some guidelines. Could you just do these?
Well, my impression is that from my experience, this is my impression. The Federal Trade Commission typically does not appear to go after companies that are not marketing to high-risk individuals. So if you were marketing a product for weight loss, you're going to be on the FDA's we should be aware of this list. If you're going to be marketing a product for I don't know.
Like heart health or something?
Yeah,
Oh, are you thinking
if you're going to be marketing,
something easy?
yeah, no. So if you're going to be marketing a product for diabetes, you're on the FDA radar, FTC radar. If you're doing it for weight loss, yes, you'll be on the FTC radar. Cancer and HIV and those type of terrible diseases, yes, you're going to be on their radar. If it's something that's general heart
Like
health, general
appearance.
skin, you're probably not going to be on their radar. The Federal Trade Commission, they work to police the industries, if you will, by both being aware of what's in the marketplace, becoming aware of it by litigation, becoming aware of it by other programs that exist in the marketplace. So, for example, the Better Business Bureau, the BBB that most people have heard of, they have something that's called the NAD, the National Advertising Division. And the National Advertising Division is a sort of a non-governmental organization that reviews marketing for truthfulness, accuracy, and substantiation. And companies can go to the NAD to challenge another company, or an individual can go to the NAD to challenge a company on the veracity of a claim or a claim set. And I have seen this where one toothpaste company goes to the NAD about claims made by another toothpaste company, and then the NAD will ask for a certain amount of paperwork, review everything, and give like a judgment. Now, the judgment is not legally binding, but most people, companies, they heed, they pay attention, they do what the NAD lays out, because if you don't, meaning if you ignore what the NAD's ruling is, then you get pushed to basically to the top of the FTC paperwork, because by that time the NAD has done all of the legal homework for the Federal Trade Commission, and if you're not agreeing to the changes that they're suggesting, then you're on the FTC's radar, and it's not that hard for them to come after you.
Interesting.
So there are not just the FTC; there are other ways and means that companies and individuals help to try to monitor advertising and marketing, but ultimately a lot of it does go to the Federal Trade Commission.
So then where does the FDA, the Food and Drug Administration, come into this? Because I also get a little confused, and I know they're trying to get into this with the Durbin Bill. But I do get confused because the FDA does not regulate supplements, but now they're trying to possibly,
that's
just
a misnomer.
tell us about all that.
That's a myth and a misnomer. Most certainly, the Dietary Supplement Health Education Act of 1994, signed into law by President Clinton again in 94, made dietary supplements a regulated products industry under foods. So the Food and Drug Administration regulates the dietary supplement industry under a subset of foods. They also regulate pharmaceutical. They also regulate over-the-counter and many other medical devices and other things. Most certainly, the FDA has mandates to regulate by Congress the dietary supplement industry, and they do. Now, whether the FDA actually enforces regulations that are on the book, that's a different topic. But there are many laws that are in place regulating on a state level and a federal level the dietary supplement industry. Now, what you asked was, how does FDA fit in? And I'm going to finish that sentence or thought into as it relates to marketing of any product. So let's say dietary supplements. If a dietary supplement product was being marketed to help you control your blood sugar for better diabetic control, that the FDA, then that actually becomes a violation of FDA laws, because you're not allowed to make disease claims for dietary supplements. And that's written into the SHEA Act. So the FDA will regulate claims in marketing if they fall over or spill over to be disease or condition related. If it's other aspects of marketing and advertising, then it's regulated by the Federal Trade Commission. The one way to think about this is the FDA regulates what's in the bottle and somewhat what you write on a bottle, while the FTC more regulates what you say about the bottle.
Interesting. Okay, thank you. I'm literally taking notes because I really was confused because I literally had, and maybe like, are vitamins not health supplements? But I had a vitamin manufacturer say that the FDA does not regulate vitamins. So then I'm just confused.
Whoever
I'm
said
not
that
saying
should
who.
not, it doesn't matter. That person should not be in the industry if they don't know that they're regulated, because they actually, if they understand the laws of the business that they're trying to operate in. For example, if you, Amy, wanted to come out with a dietary supplement and you contracted with the private contract manufacturer to make your product, right? And still, you would have to submit to the FDA a 30-day notification of market and marketing claims. You would have to submit a whole host of other documents to let the agency know you're in business and that you're selling dietary supplements and that these are the claims that you make and that you believe that they're substantiated. And there's a whole host of other things that has to get done. So it's sad to hear that somebody in the industry doesn't know that they're in a regulated industry. I would be scared to buy products from them.
I'll just say that because the questions I asked, I mean, we have a vetting process. And so once you get me, you're getting asked questions. Okay.
Yes, I've learned
especially
that.
if we're talking about, especially if you're talking about health or diversity, equity, and inclusion. Those are we're not messing around. Okay, so we're going to ask some questions, and if you can't answer it or it's an odd conversation, we're just moving on. And that's a great way to vet a client. But anyway, so tell us about, because the FDA situation is confusing, and you've told us a little bit about it, but what is this new Durbin Bill, and maybe that would affect marketers or not? I don't know.
Well, this new bill that was proposed by Senators Durbin and Braun is a bill that they are saying is about transparency. And so they're saying it is about transparency so that consumers will know about the ingredients that are in the product and the product label. And
and this is through the FDA. Let me just clarify.
Yes.
So they're asking for more info.
Right.
For us to submit to the FDA.
Right. Senators Braun and Durbin are asking the FDA, are asking for Congress and the president to approve to Congress that they would like ultimately to give the FDA new authority, added authority, meaning more authority over the dietary supplement industry. Senators Durbin and Braun said this is about transparency and public health. However, when you read the actual words of the bill, there is nothing that is in the bill that would actually increase public health or increase FDA's policing of the marketplace. The bill essentially requires responsible companies to submit labels for each product and where the product is manufactured and every place that the product is held, meaning warehouses and stores sold, and much more. The FDA, Senators Durbin and Braun said that this legislation is aimed to help keep illegal ingredients out of the marketplace. However, this legislation does not have any aspect of policing ingredients that are shipped into this country or made in this country for use in dietary supplements. Under current laws, and always since dietary supplements became a regulated industry in 1994, FDA, along with Customs and Border Patrol and other agencies, have always had the ability to inspect shipments coming into this country to manufacturers and others. They have always had the ability to take ingredients off market that are not supposed to be on market. So what do we worry about? We worry about, in general, that Senators Braun and Durbin say that this is legislation that will keep adulterated products off the market. And let me give you an example of an adulterated product. An adulterated product might be a product that's being marketed for weight loss, but instead of actually containing what the label says is in the product, also contains some undeclared drugs, like sibutramine is typical. Some of the products that are marketed for sexual enhancement or sexual experience enhancement, if you will, that you see sometimes, unfortunately, at gas stations and other places, they have been found to be laced with Viagra or Viagra-like pharmaceutical compounds. Those are not dietary supplements. Those are adulterated drugs, adulterated products that the FDA is not currently getting off market, although they have full authority and ability to do so. And here, Senators Braun and Durbin are claiming this will give the FDA authority from preventing it. Now, when you read the legislation, all companies have to do, not all, but meaning like not just total, but what companies have to do is submit, their label and other information to the FDA, wait for FDA review and say yes. So the question that we ask is, well, the people that were putting the illegal drugs in other products that were being marketed as dietary supplements, they're not going to now put it on label. Oh, we're putting sibutramine in this weight loss product, or we're putting in Cialis in this sex pill. So they are still going to keep doing the illegal things that they're doing, and the FDA will keep turning a blind eye. So this legislation does nothing except waste taxpayer dollars. And let me explain why I say that. So Senators Braun and Durbin asked for, I believe it is $4 to $6 million to be allocated to the FDA to start this program and to help run it from 2023 to 2026 for 3 years. Did you know that the National Institutes of Health has an Office of Dietary Supplements that collects under congressional mandate, meaning mandated by Congress, collects dietary supplement labels for products that are marketed in the U.S. They currently have 136,000 labels in what's known as the Dietary Supplements Label Database. When you ask the FDA, do you ever go in this database? That Congress gave you the charge of creating it with the Office of Dietary Supplements. The answer is no. They don't use it. And why does that piss me off? And excuse my irresponsible language there. It's been acknowledged. There's been over 50 million of our taxpaying dollars that have been invested in building just the dietary supplement label database website. 50 million. Do you have 50 million to throw away? So wait, now you have Senators Braun and Durbin not doing anything to fix a system, but yet where does the money to FDA come from? It comes from our taxpaying dollars, right? It's not an agency that makes money. It's an agency that spends money. There's 19,000 people that work for the FDA. Did you know that there was less than 350 inspections of dietary supplement manufacturing facilities last year? That's disgusting.
Yeah. I mean, we're talking about health. I mean, yeah, it's people's health.
Yes.
It is disgusting. So,
I'm sorry. One second, Amy. This is important. So, to me, why isn't more major news that Acupril, which is a blood pressure medicine made by Pfizer just issued a recall because they found in their manufacturing processes that besides making the drug Acupril, that they're also creating a cancer-causing compound, the nitrosamine, that is being captured and then put into that pill with the drug. That is a public health concern, right? So how many people do you know that take, blood pressure medicines and now may be exposed, millions and millions of people, to cancer-causing agents that should be first thing on the news? Hey, if you take Acupril, call your doctor. Need to get off. You may be at risk for cancer. That does not happen with dietary supplements.
So how would we know about all of this as we're consumers? Where does a general consumer go for this kind of information?
You got me. The general,
Yeah.
and I know about it from my various, I don't know, electronic subscriptions. I get FDA updates. I get various medical journals. I get various press releases that occur within the medical world and scientific and nutrition world. I read about it, about a week ago.
Yeah.
So
It seems like people just need to be taking or just paying more attention. So the other thing I just know about, but I'm not really into CBD, but is that CBD is now in everything, right? So now we have to think about, well, so these supplements and even lotions and things are really popular, but now can you overdose or overdo it? And I think CBD with kids, there's possibly a possibility for that. I don't know.
I think that there's, one of the things that we do know about CBD, and CBD is just one of the cannabinoids that occur, of course, in cannabis, in hemp, in marijuana, and so forth. And CBD, we do have a pretty good idea of what a safe dosage level is, because we have pharmaceutical CBD that has a plethora of safety studies on purified CBD, and there have been many projects taken up around the world that have analyzed, human reaction to CBD. For children, that's a whole nother discussion. But we generally know that, for example, the FSA in the United Kingdom, which is the Food Standards Authority, similar to our FDA, they placed an upper limit, I believe, of 71 milligrams a day of CBD as their upper limit of a safe dose. Most products, I think, are sold in the 10 to 25 range.
Okay.
So we do have authorities around the world, just not the FDA, yet discussing the what I'd call the commercial CBD that's out there. It's interesting to note that from a regulatory perspective, CBD is actually illegal on a federal level. However, most of the states of the United States have legalized the ingredient in some form. So there's a state versus federal battle that's going on. And 4 years ago is when Congress was first asking the FDA, hey, CBD is getting popular. We took hemp off of the DEA Schedule 1 list. So, can we get it to be commercially approved? And FDA said, we will study it and we will work on it. And now we're 4 years later and there's no movement about FDA federally approving CBD yet. So
interesting. Okay.
It is so for those people that listen that are, that utilize CBD products, they're regulated on a state level. On a federal level, they're actually considered illegal.
Yeah. So what I've noticed from you, as you are a thought leader in the space, which is interesting because you're not in marketing. So you're not sitting there thinking about how can I get, visibility, because you're too busy for that. But what I've noticed is that you do take a stand on LinkedIn, no matter how controversial it may be. And so for PR people, we always hear that taking a stand can be effective. While it's dangerous, it can be effective. But so when you have, like earlier you said, pissed off, when you get pissed off about something, what are your thoughts on how to get your opinion out there, and any tips on maybe how not to get in trouble? I mean, I don't know how sometimes we put our own foot in our mouth, but any thoughts on thought leadership there?
I think that if you come across as an authentic person and you use facts as a basis of your conversation, then you have the ability, at least, to be taken more seriously and listened to. From a marketing perspective, whether it's polarizing or not, it seems that the public likes when people take a hard position. Doesn't mean it's always the right position. But if we look at politics, if we look at other things in society, people like when you take a stand, because either you're standing for something or you're against it, which to me is manipulative marketing. It has nothing to do with nothing. It's not that I'm for or against. How about I just want to learn more? One of the things for companies that are in the dietary supplement industry, before you approve an ad that's going to go out to market, minor little checks and balances. Did you read the FTC, the Federal Trade Commission Guide to Advertising for the Dietary Supplement Industry? Because in that guide, they give some examples of do's and don'ts, which are useful. Have you taken a look at creative marketing? Different ways of saying something, but saying truthful to what the authentic truth is about the product. I think that it's really important I understand that, people like to sell a dream, but it has to be realistic, right? I was always told that part of what works in marketing is having a hero story. And I like people to be their own hero. And it's very hard. It's very hard for an average consumer to be their own advocate at times, because there's so much information today coming at people over the internet, over text messages, over commercials, over anything that you could think of, that, we have to slow down and decipher. Does it sound too good to be true? Right? That thing that mom taught you, does it sound too good to be true? It probably is. Works. So as a marketer, I would ask myself, does this sound too good to be true? And if it does, well, do I have enough so it really is true? You know what I mean?
Yeah. Yeah. No, that's great. Yeah. Perfect. Yeah. We just want to be careful, especially when dealing with health.
Well, one of the things I would like to ask, if it's possible, is that for the people that listen to this, podcast, if you want to learn more about what we're calling the mandatory product listing, this new Senator Durbin Braun introduced bill, if you go to even to the website npanational.org, we have a ton of information, even links so you can read the actual bill. And then we actually ask you to be honest and authentic in my marketing here. We do ask you to click a couple of links that have these preformed letters that will go directly to your representatives in your state, saying whether, basically asking them to vote no on this. There's a lot of concerns that this does nothing for public health and adds economic burden to every company in the supplement industry, while also increasing risks of bioterrorism, believe it or not.
Interesting.
And that I can explain on a different podcast if you want, but that is reality.
Sure. But I just to add, if we increase costs for companies, then that's directly affecting the consumer.
Oh,
I mean,
without doubt.
Then,
without doubt. Yeah. Without doubt. No company is going to say that they had to hire all these new full-time equivalents and that they have to do this extra, work and then not pass it off to the consumer. It's not like the FDA is going to give it to them, or the IRS is going to say, here's a special tax credit. So yes, you are right. In the long end and the short end, consumers get stuck with the bill. And so then we will end up paying more for your vitamin C, and at the same time, not having any greater public health protection from the government, or for the government, or from them, or with them, anything.
Exactly. Yeah. Okay. Well, thank you so much for your time. And this has been great. I think we have a lot of good resources to give to our people, and we'll add the links to some of the resources in the blog post that recaps this episode. So thank you. And hopefully it's not too hot for you in Florida.
Thank you so much. And I appreciate the opportunity to be on this podcast with you.
Thanks for listening. For more PR insight, be sure to check out Amy's book, A Modern Guide to Public Relations, at prtalk.co. Also, please subscribe, rate, or leave us a review.